Do you have a child but desperately want another? Do you feel guilty, or do others tell you you should feel guilty about not being satisfied, in air quotes, with what you already have? Secondary infertility is its own kind of torture. And today I am speaking with Allie Karagozian of Holding Both, an organization designed to support those with secondary infertility. Welcome to Baby or Bust Fertility Podcast, the podcast with interviews and in-depth discussions on all things reproductive health. It's created to support anyone curious about infertility, miscarriage, and early pregnancy. I'm your host, Dr. Lora Shahine, a double board-certified OBGYN and reproductive endocrinologist, former fertility and IVF patient myself, helping people build their own families for almost 20 years and dedicated to supporting and educating you on your family building journey. Today, I am thrilled to have Allie Karagozian on the show. Allie, welcome to Baby or Bust.
Thank you so much for having me.
Oh, I'm really happy that you're here. So, Allie, you are an occupational therapist who dealt with your own secondary infertility, and now you're looking to support others on that pretty tough journey. Tell me a little bit about your story and how you came to create Holding Both.
Yeah, so as you said, I'm an occupational therapist. I live just outside of Chicago with my 2 kids and my husband. After my second maternity leave, I did a lot of reflection when I went back to work. I was working full-time in the hospital, and I was reflecting back on my time leading up to conceiving my second son and afterwards. And I experienced infertility myself and went through IVF to have him. And important context during that time was it was also the height of the pandemic. So that time was a very profoundly challenging time for me and my family. And I knew that I could create something that could help people who were experiencing difficulties trying to conceive subsequent children.
Well, I love how you, it's the first time I've ever heard it. So I'm just going to give you credit for coining the term mothers with infertility. Like that is such a paradox. And it's like a makes you stop for a second and say, what do you mean? Like if you're infertile, you're not a mother. And it is this really unique, secondary infertility. You have a child, but you want to add to your family. And it's something that I had too. So I think when I think honestly, it was just an Instagram post or something. I was just like, wait, what is this? And then I started listening to your podcast and I checked out your website. I'm like, this is so unique and it's so needed. You talk in your podcast about how infertility is a club that you don't want to join with like great members. And I feel like secondary infertility is like a club within the broader club of infertility. It's just so unique. How did you find it different? Because you had trouble having both of your kids. So you experienced primary and secondary infertility. So for you, how is that different?
Yeah. So for me, I experienced primary and I remember thinking to myself, I had a miscarriage and then we went on to do Medicaid cycles and IUIs. And I remember thinking to myself, if I had a child at home, this wouldn't be as hard.
Mm-hmm.
And that was what I was trying to tell myself. But then fast forward 3 years or 2 years, it wasn't easier. It was just different. And so I remembered and reflected on myself during that time when I was trying to conceive my first, and I had compassion for that woman. But then I also had compassion for myself at that moment because I did have the joys of motherhood to comfort me, but motherhood, as we all know, can be really challenging too. So there was the joys and challenges of motherhood, but that didn't discount the pain I was feeling from infertility and loss, and it didn't take away from what I wanted in the future.
Yeah, I feel like you're describing that kind of tension between being grateful for what you have, being grateful that you are a mother, but also that sort of guilt for wanting more and like actually still wanting more. I mean, it's this real tension and we do it to ourselves, but other people certainly put that on us too, like trying to comfort you. I'm describing my own experience, but just, oh, you should be grateful for what you have. Like you are a mom. You're like, why are you so worried about this? Did that ever happen to you?
Yeah, it did. And I think it was always well-meaning.
Yes.
For the most part, I
Yes.
want to say that it was.
Yes.
But it was sometimes when I'd be the recipient of that, I would think to myself, oh, should I just be grateful for what I have? And so
Mm-hmm.
it was this cycle of me trying to get out of that guilt that I was feeling, but also just validating my own feelings of it's okay to want another child. And if I wasn't experiencing infertility and if I wasn't experiencing pregnancy loss, I don't think this conversation would come up at all. People would
Mm-hmm.
just go on to have another child, go on to have
Yeah.
a third child. So, yeah, I was able to quiet that voice most of the time.
Mm-hmm.
But I did know that I wanted to create something so that people could land on my Instagram page, land on my website, find my podcast, and feel like they belonged.
So when you describe the infertile mother, there's somebody else in this equation. Can you touch on the guilt that you can feel as thinking about providing a sibling to that child that you have? I just feel like there's this, when you have primary infertility and you don't have any children, you have this underlying fear. And it was honestly terrifying for me. Like, I always wanted to be a mom. What if that's not going to happen? Like, that is a deep seated fear. But then when I had my daughter and I was worried about having another baby to complete my family, I had this other person in the equation, right? Like this guilt that I wasn't going to be able to give her a sibling. Can you touch on that feeling? Am I the only person that feels that way?
I felt that way a lot. I grew up with siblings myself. I'm the oldest of three girls. And when I was thinking about how I wanted to build my family, when my husband and I were having these conversations, both of us are one of three. The spacing for my family was the spacing I had in my mind, 2 years, and then 3.5 for my third, if I decided to have a third. And so when that mark kind of came up and I wasn't pregnant and it hit me a little bit harder.
Yeah.
I was thinking about my son a lot. I was thinking about him, especially because it was the pandemic and he was not in school at that point. Like he
Mm,
wasn't in daycare at that point. And I was worried about having a sibling for him, but also just, yeah, it was my own infertility, but having a sibling for him and what I envisioned. And this is a theme that comes up a lot is the age gap, and I'm sure we'll talk about that a little bit too, is that with each month that passed, I saw the age gap widening between my hopeful second child and my first.
absolutely. I actually had my mom on the podcast for episode 51. I had her on the podcast and we were talking about her fertility and how I didn't know until recently that she had endometriosis, all of these things. And she always talked to me about how she and her sister were not very close because they were 4 years apart. And she was
Oh,
convinced
wow.
that being 4 years apart was not far enough to be like a, mentor, kind of older, and not close enough to kind of get along, but just, enough to not work. And my kids are 3.5 years apart. And I was like just stressing. So, and it was just something that, where does this like 2 year age gap come from? That's what most people think about in society. And you just worry
Mhm.
about them not getting along. Like, where does that come from, Allie?
Yeah, I don't know. I can tell you that my 2 year age gap came from me and my sister.
Mm,
That's where I kind of had it in my mind. Something that came up in one of my group meetings the other day was a woman said, "Where did this 2 under 2 come up?" Because this
mm.
hashtag is coming up all over the internet where
Oh, no, that just
people
stresses me out to even think about.
yeah, where
Okay.
people have 2 kids under 2,
Wow.
and it's seen as like a badge of honor. And
Mm,
I'm sure having 2 kids under 2 is very difficult,
mhm.
but I don't think it should be some like a stressor that people put on themselves. And it's difficult when you're in the thick of infertility and you're thinking about the age gap.
Yeah. And also I come from a blended family and I didn't really have a sibling that was really close in age to me growing up, and so I always kind of wanted that. And are you aware of this book by Lauren Sandler called One and Only: The Freedom of Having Only One Child and the Joy of Being One? Do you know that book?
No, but I'd love to give it to my friend because
Yeah.
she's in that space.
It's really good because it is a journalist who grew up in a single mom home, and she was an only child. And her whole growing up, her mom would say things like, "I'm so glad it's just you because I'm able to provide all this attention and all this caring because you are only one." And then the author, journalist, she has a daughter. And now she is reflecting on, do I want to have another?
Wow.
And she goes, oh, it's so good. And
I'm
then
going to read that.
it's really
Yeah.
good. And she goes through actually all of the research. And I might have not get this perfectly right, but I'm pretty sure that the very first speech given at the American Psychiatric Medical Society is about how you're going to be frail of mind if you are an only child.
What?
Yes. And this is way back, decades and decades ago. And now the studies are actually saying having one child is amazing,
Yeah.
you do have so many more resources and like they're very, highly capable. And, she points out things like just because you have siblings, it doesn't mean that they're going to get along or it's going to be a good fit. And what's great about the book, and I think I got to try to find her and have her on the show, but at the end of the book, you don't know what she decides. And so forever, I've recommended this book to my patients who are like, I have one, I'm not really sure that I want to have another one. I feel like I should because society says I should. And, everyone else always asks me, when am I going to have another? And at the end, you don't know what she decides. And so it's a
Wow.
great book to recommend to kind of that push and pull, that kind of back and forth.
That's interesting because
Mm-hmm.
one of the groups that I offer is called the Complete Circle for those who have experienced secondary infertility and are at the end and have decided to move forward into motherhood that they didn't expect after secondary infertility with their one child. And I think that would be a really valuable book to recommend to those women.
So Lauren Sandler, one and only. Check it out. All right, we will get back to talking to Allie in just a minute. Right now, I wanted to ask you for a special favor. It would help the show so much for a review. Anywhere you listen to your podcasts, this is one that came out recently, and I appreciate it so much. From B. Shanka, Dr. Shahine, the education you share on your podcast and Instagram platform has given a lot of reassurance and guidance in combination with what I am learning from my fertility physician. Thank you for what you do. You are so appreciated. Wow. Well, B. Shanka, you are appreciated. Thank you so much for taking time to put on that review. And let's get back to the show. Tell me a little bit more about your organization, Holding Both. You just mentioned one of the circles. So you have these groups, right, that people meet. Can you tell me more about that?
Yes. So I started Holding Both with an Instagram page. And then I decided I wanted to do one-to-one sessions in groups. After I started doing the one-to-one sessions, I was using my skills as an occupational therapist to run those. But I ended up realizing that what really lit me up was the groups. And I set down the one-to-one sessions and focused on building community. And so with my groups, I meet with 4 women and myself virtually every week. And I have a couple different types of group offerings. And it's been really powerful to provide community and space and processing groups for them.
And is it something that they meet for a certain number of sessions, or is it ongoing, or how does that work?
So it's a 4-session commitment.
Mm-hmm.
So 1 month commitment. And some women decide to end after a month, and then some women decide to continue on. So I would say 2 months is the average of how long women stay. But I've had some women do 4 to 5 months, and I've had some women just do 1 month. And many of these women have remained friends after. So it's really powerful to see that.
Oh, and is it online?
Yeah, so it's online.
Uh-huh.
So I live in the Chicago area, just outside of the city, and a goal for myself in the future is going to be to have in person because Chicago is such a big
Mm-hmm.
area that I think that there would be interest. But yeah, for right now, it's online.
Well, and I think it's such a unique space because there are amazing national organizations for infertility. Resolve.org. I refer to people all the time. You can go there right now on the website, put in your state, put in your city. You can find maybe sessions that are meeting in person. Some people like online sessions. But when you go there, it might not be a lot of people that are struggling with secondary infertility. And there's a little bit of push and pull, like, just kind of like between the people who've never seen a positive pregnancy test and people dealing with recurrent miscarriage. There's a little bit of tension. Sometimes people don't talk about this, but how, oh, well, at least you can get pregnant. I've never even seen that. And I could see how some of the groups, if you were sharing that it was secondary infertility, there can be some tension there. So for you to provide this space for this, unique group of people and exactly what they're dealing with is really special.
Thank you.
Yeah, it really is. I kind of feel like secondary infertility is its own kind of torture because you are on the playground with your current child. You are at birthday parties with women who have pregnant bellies or carrying a toddler, and you're still, have your one child, which is still amazing. But it's like the questions, like it's, oh, are you guys trying? Or are you going to have a sibling? Or even it started at my daughter's first birthday party.
Yeah.
They were like,
Yeah.
oh, she's one. Are you trying again? I was like, oh my God, I just got over the fact that I actually have a baby. Like,
Yeah.
just, do you in your groups, do you have any sort of structure where you're sort of talking about ways to deal with comments like that or sort of things that kind of come up that are unique to people with secondary infertility?
Yeah, so each week I have a couple questions that I like to bring up and ask and use those to guide the group. And one of the topics that we had talked about was daycare or
Mm.
school.
Mm-hmm.
And we talk about the challenges with that. And sometimes women will say, and I can think of one specific instance in particular where someone said, my daughter is now the only child in her classroom, and
Mm.
it's been brought up to us by the staff and stuff like that. So those themes come up a lot. Or someone said, I noticed another mom look into the back seat of my car as to see if,
Oh.
is anybody else there? And
Mm.
it's a familiar feeling for
Mm-hmm.
those of us who have been there.
Mm-hmm.
And so I do find that when we talk about these topics and when I bring specific instances in or guide the conversation in certain ways, many of the women can relate. And sometimes we don't cover everything in the specific session that we meant to, just because one topic will get carried off and I let the group go as it will.
Yeah. So how do you think your training and your role as an occupational therapist kind of helps you with the support that you bring to the women in holding both?
So, as an occupational therapist, I've worked in a wide variety of settings, but the setting that I think helps me the most is when I worked in a mental health unit and I would run groups. And so, those groups would be for people, I would teach things like assertiveness training and reintegrating into the community and things like that. And while I'm not using those specific skills for this, I'm skilled at facilitating groups, but also occupational therapists address barriers that people have to living their lives in the ways that feel meaningful and feel manageable for them. And I think anybody who's gone through infertility knows that infertility is such a barrier to many areas of our lives, and it can put up many roadblocks that I think I can help people with.
Yeah, I think that's beautiful. And I mean, I think it's important to note, so you're not a mental health specialist, like you're not
No,
a
I'm not a
trained
therapist. Yeah.
therapist. And so I'm sure that if you were seeing something in the group that people really were struggling, you would help them find resources. But I also, I feel like my patients that are really suffering emotionally or struggling with mental health during fertility treatments, sometimes the only thing I would have to offer them is a therapist. And they're like, oh my gosh, I don't want to go to one-on-one therapy for many reasons. Sometimes there's access to care. Sometimes like the wait lists now, oh my gosh, are forever. And, there are a lot of therapists that don't have a lot of training and just grief or sort of even understanding what fertility is like. Like at my practice in Seattle, Pacific Northwest Fertility, we have a list of therapists that are really interested and even like reach out to us. And
That's incredible.
because you don't want to be in therapy and having to explain to your therapist what IVF stands for,
Yeah.
but just like we had here, we had the miscarriage doula, Arden, on
Yeah.
here kind of. And so that's like
I've
such
taken
a,
her course. She's
really?
amazing. Yeah.
Oh, she's so special.
She is.
Yeah, so you kind of see that there's ways to provide support and community that are really addressing these emotional issues, and it's not a substitute for, therapy or mental health needs, but it is such an incredibly valuable option.
Yeah.
And it's not intimidating, I'm not sure what the word is, but like just hearing like, hey, it's 4 sessions, give it a try, see how it goes. Like that really could, it just opens it up a little bit. It's nice to hear that it's 4 people at a time, because I can imagine if it's like, lots and lots and lots of people, you feel like, gosh, I'm never going to be able to talk.
Yeah.
Yeah. You said you've changed it a little bit. It used to be like individual and now it's more groups. Anything else change as this is developing?
Yeah, so adding groups. So mine initially, I was secondary infertility groups only. And then the complete circle, as I mentioned, I'd added that in, and we haven't actually started that. That'll start in the spring. But then the third circle, which is secondary infertility trying for a third. So
Yeah.
that's like a smaller subset of women. And so that one was pretty incredible because a couple of these women really never found anybody else that was in that space trying to have a third. And something interesting that came up from that too, it was just such a rich conversation of the women who had one boy and one girl,
Yeah.
and family and friends being shocked that they wanted another. So that was a really good conversation to have.
Yeah, thank you for bringing that up. I mean, I have patients who sometimes actually delay coming to see me because they feel like they don't, this is not the right word, but like they don't deserve to, worry or do fertility treatment in order to have a third or a fourth
Wow.
or whatever it is. And I just like that, where is that coming from? Like nobody is going to be able to tell you when your family is complete, just because the ideal family, and big, huge air quotes, is like 2 kids, 1 boy and 1 girl. Like that does not mean that that is right for you. And I mean, that is so unique, the third circle. Like,
Yeah, it's been fun.
and they're going to find a place that where they feel really safe and they're able to really express how they feel, where they might get really shot down in other situations. And I really appreciate your providing that.
Yeah, thank you. I wanted
Yeah.
to say something too about the therapist. So my husband is a therapist, and so he and I have had a lot of good conversations, especially at the
Mm.
beginning when I first started this.
Mhm.
Is that I have training in mental health, but I'm not a mental health provider, and I do make that very clear. And one thing that I love is that women have sent me direct messages saying, "Can you please tell me where I can find a therapist? Can you
That's
please?"
really good.
And so my husband and I talk about that all the time, is guiding
Oh.
people in the right direction. So
Oh, I wonder if he might open a circle for men
I know.
with secondary
I know. You know,
infertility.
it's funny because some of my group members in the past have said, "Can he do this for my husband?" Because my
Um,
husband needs this.
Hey, you heard it here first. No, I'm just kidding. But I just think, I mean, it's super clear on your website and, and your support that you're really focused on women. That's what, you're most comfortable with. That's who comes to your group. But I do have other resources for the male partner or the person who's not getting pregnant. And so anyway, I'm teasing you, but I'm also kind of like, hey, let's plant a little idea there.
I know. I think that that would be great.
Really, truly, truly. There's not enough support. Men are half of the genetic equation. They need a seat at this table. It's happening to them as well. And honestly, I mean, your husband can speak to this, I'm sure, but they often just don't feel that they deserve to explore their own feelings because they're not the ones who are getting pregnant or doing the shots or doing the egg retrieval, but they're going through it just in a different lens.
Absolutely.
Yeah.
And
Yeah.
especially the different complexities with male factor. And that's something that comes up a lot.
Yeah, absolutely. Well, I am so excited to meet you in person. Please tell us how we can find Holding Both and get connected with you.
Yes, so I am at Holding Both on Instagram. No periods or underscores or anything like that, just Holding Both. I have a podcast that can be found on all podcasts, anywhere that you stream them. It's the Secondary Infertility Podcast. And then my website is www.holdingbothllc.com.
Awesome. Allie, thank you so much.
Thank you so much for having me.
I hope you enjoyed today's discussion with Allie and learning about Holding Both, her organization for secondary infertility. It is a unique club within the larger club of infertility, and it's so good to know that there's a special place waiting for you if you're looking for this kind of support. Find this episode and all others at my website, drlorashahine.com. Find me on YouTube, Instagram, TikTok. I love educating. Reach out to us with an email, hello@drlorashahine.com, with people you'd like us to interview, ideas you'd like us to cover. Thank you to our friends at Seattle Sperm Bank and Braze Run Production for sponsoring the show. Thank you to my producer, Shannon Perry, and her team at Audiotocracy. This is your host, Dr. Lora Shahine. See you next week. And until then, wishing you love, luck, and pineapples.